Novamind has granted DEA licenses for psilocybin research. Before we get into why that's important, because when you get drug enforcement agencies granting licenses, that's a pretty important thing. First, let's talk about the fact that these licenses are for psilocybin. Why the interest in psilocybin as a potential treatment for mental health problems?
Yeah, I like that question because as a psychiatrist, I know extremely well that we need new and improved treatment options. Too many people are suffering, and psilocybin is actually the active ingredient in magic mushrooms that was studied with really exciting preliminary results back in the 60s, but unfortunately became illegal, like Schedule 1 by the DEA and very hard to access. But there is this growing body of evidence. It's come back into the research world now. And for example, one study showed that one dose of psilocybin plus a bunch of therapy led to significant lasting changes in clients with severe depression. And as a psychiatrist, without having to take a daily pill, this is pretty exciting.
And I remember you and I had spoken last time when we did our first review way back a few months ago. You talked about it's having some incredible impact even on veterans who are suffering from PTSD that normally would need years of psychiatric help, that literally weeks and months through psilocybin.
Yeah, and actually, so psilocybin is under a fast track designation from the DEA for depression. So that will likely be its first indication. MDMA, another Schedule 1, is being studied in a similar way, fast track status for PTSD.
Oh, okay, it was MDMA, right?
But they both show promise for a number of other things. For example, psilocybin has had strikingly positive results for end-of-life anxiety, for example.
Hey guys, the video's over, but don't forget to help your company by liking it and even leaving a comment below. And then don't forget to help yourself by subscribing to our YouTube channel so you never miss another great AGORACOM small cap video.